Let's talk about some nursing care if you are taking care of a patient on ECMO. My name is Leah. I've been a CVSU nurse for 19 years, and today we're going to talk a little bit about nursing care for a patient that is on ECMO. So first and most importantly is if you have a patient on ECMO, you need to make sure that the patient's cannulas are secured per your protocol and the policy for the place that you work. Those cannulas can move and it can cause death or life-altering consequences. As the nurse, know what the policy is of the place that you work on, how to secure the cannulas, who's responsible for securing the cannulas, but even if it's not you that's responsible for touching the cannulas, you should know how they should be secured at the place that you work and what the policy is for who can change them. The next nursing consideration is to follow the map. A lot of times with patients on VA ECMO, you're not going to have a systolic blood pressure, and so you're going to need to follow the map to know what's going on with your patient. Talk with your provider and see what the map goal is for your patient. You should be hourly documenting things like your patient's SaO2, the RPMs, the flow, the circuit pressures if those are available to you, and the urine output. You should also be hourly monitoring your patient's peripheral pulses, especially in any limbs that are distal to a site where there's a cannula. We commonly place return cannulas in the right femoral artery, so make sure that that leg has good pulses below. I would Doppler them. If you lose a pulse, that's an emergency. You need to inform someone immediately. They may be able to place a reperfusion cannula if they know quick enough and be able to return circulation to the patient's leg. Monitor the dressing where the cannula is present. Most of the time, if a clot has formed, they may leave that in place. Removing the clot and cleaning it too good may cause it to rebleed. But follow the policy where you work. Fluid management is essential because these pumps, like many that we deal with in an ICU setting, are preload dependent. So we have to make sure that we are removing fluid if the patient needs it through CRRT or if they're still making urine, but that they have enough fluid to move around. If you want more resources, I've got some linked in my bio. Comment below, let me know what I missed. Let me know some other questions you have about patients on ECMO.